Hi, everybody. Welcome to the Oldish TV. I'm so glad to have you join us today. And for those of you who are new, welcome. For those of you who have been with us before, I'm glad that you have come back. And I'm particularly grateful to our viewers who watched last week's show, which was all about how to properly wear and handle a face mask. There were nearly 13,000 of you. And I'm blown away by that. So thank you very much. I'm grateful. I also appreciate the many lovely comments that were left as well. For those of you who don't know, if you put a comment down below as we are live broadcasting, I will see it. I will see it come up live here. And when there's an appropriate opportunity to take a break and address questions, I will do that. So today I have a couple of updates for you, and they are, I believe, quite meaningful. Now, I don't want anybody to get the wrong impression. This is not going to turn into the coronavirus information channel, not by any stretch of the imagination. And I don't want week after week to be talking about face masks. That's not what this is about either. There are a lot of issues that affect people who are aging. However, science is moving very quickly, and most of our viewers tend to be over the age of 50. And for that population of people, the coronavirus has the potential to be something very serious. So when there's new information, I want you to know about it. I particularly want you to know about information that I've had an opportunity to do some reading on so that I bring you accurate information. Dr. Google is not necessarily your friend in this environment. So stick with me, all right? So, do you remember about 5 months ago when we first heard that coronavirus was a thing and it was coming to Canada and to the US and to various countries around the world? Because I know we have viewers from all kinds of countries. We were told that we did not have to wear masks. In fact, we were told specifically not to wear masks, that all the masks that existed needed to be saved to be worn by healthcare professionals so that we kept them safe because they were in close contact with people who were sick. And of course, we need our healthcare providers to stay well, or we have nobody to look after us. In Canada, on January 23rd, Dr. Theresa Tam, who is Canada's public health officer, told reporters that wearing a mask is not an effective preventative measure. In fact, she said, and I quote, and I've got a lot of stuff written down today because I want to make sure I give this to you absolutely accurately. She said, and I quote, "It can sometimes make it worse if the person puts their finger in their eye or touches their face under their mask. We would only recommend putting a mask on if you were sick and were entering a medical facility such as a hospital. We have no recommendation for people to wear a mask going about their daily business." That's what we heard. At that point, scientists believed that coronavirus was transferred via droplets, so moisture. Rigorous hand washing and social distancing is what was recommended. Fast forward to early April, and again, Dr. Tam addressed us and changed her advice and suggested that wearing a face mask could have some benefit. Health officials, though, noted that there was no evidence that a non-medical face covering, such as a homemade mask, bandana, or scarf, could protect the person wearing it and should instead be considered an additional measure to reduce the likelihood of spreading one's own droplets to other people. This was neither a recommendation nor a requirement. I want to stop right here because I do not want you to get the impression that I am bashing science. I am not. Science is something that happens in real time. And folks, we are watching science happen in real time with a virus that we didn't know existed 5 months ago. So this is what science is. You know, they get new information, they update their database, and new recommendations can be issued. And, you know, this is going to go on and on and on. So their recommendations have, in fact, been changing as more information has been coming in. Science is definitely not a static thing, and we don't want it to be. We want them to keep on learning and growing and giving us better ways to do things. So let's carry on. The suggestion that wearing a face mask would prevent any droplets from getting past the mask, not unlike sneezing into your elbow, was the start of a bit of a campaign that said, I wear my mask to protect you, you wear your mask to protect me. I'm going to be dead honest with you. That never made the slightest bit of sense to me, not even a little bit. If something could prevent droplets from going out, why could it not prevent droplets from coming in? I didn't understand that part. Now, of course, it always matters what your mask is made out of, but anyway, that didn't make sense to me. So, what is actually a coronavirus particle? It is roughly 120 nanometers. Well, how big is that? Piece of paper like this is about 100,000 nanometers thick. So we're talking about something that is very, 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 very tiny. Now, do you understand why the material that your mask is made of matters? I can't tell you the efficacy of your mask because I don't know what it's made out of. I don't know how many layers it is. An N95 mask has its name because it is 95% effective. And those are the ones that healthcare workers need to be wearing, right? So a face mask remains one tool in your toolkit. Anyway, I wear my mask to protect you, you wear your mask to protect me became something of a drumbeat, and it still is. Here's the problem with that for the general population. And I think you understand this the same way that I understand this. If I don't believe I'm sick, what have I got to protect you from? As we are now learning, because science continues to evolve, a lot of the coronavirus is being spread by people who are asymptomatic. They don't feel sick. They don't know that they're sick. And so they're out walking about and spreading it. That's the problem. So, are you following this? If you have any questions, put them in below and I'll do my best. I am not a scientist per se, but I read a lot. So I'll do my best, and if I don't know the answer, I will tell you that. So again, science is a living thing and we are still learning. Last week, I did a class in how to properly wear and handle face masks. That still matters. That matters more than I can tell you. If you don't wear it properly, if you don't handle it properly, you could be flinging virus material all over the place. I am not counting on today's new information to be the last that we get, but I do indeed have some pretty new information for you. You may have heard on the news, but I'm going to explain this better for you. The coronavirus is now thought to be not only borne by droplets, but airborne. Scientists are thinking it is both. In fact, 239 scientists have gotten together to submit an article to the journal called Clinical Infectious Diseases. It is their belief that the coronavirus can be airborne and that mitigation strategies should be put in place straight away. The article is called It is Time to Address Airborne Transmission of COVID-19. It's a PDF. It's free. Anybody can get it. So again, that is the journal called Clinical Infectious Diseases. You can Google that and look in the latest articles for one called It is Time to Address Airborne Transmission of COVID-19. Some other information has come to light that directly affects the position that the wearing of face masks protects not only the person wearing it, yes, but the people around them. This makes so much more sense to me. Absolutely. Now, if you watch this show for a while, you know that I am really, really big on evidence-based science. If there's no evidence-based science, I don't want to hear about it. I'm not interested in somebody's postulations or their Dr. Google searches or the what ifs. That holds absolutely no evidence for me. So this new information is not evidence-based science, but rather scientific analysis by lots and lots of scientists on data collected from various scenarios, real life scenarios, things that really happened. And so why do we look at that, and why am I willing to consider that and not have it be evidence-based science? Pretty simple. It is really hard to get together a group of people of a sufficient number and have them agree to stand still while you blow coronavirus at them to see what happens. So, that whole double blind clinical study scenario, not going to happen. They did pick on some hamsters. More about that in a little bit. But anyway, the data is good, and there were so many scientists evaluating it, so I am willing to accept it as we move forward. The rationale is based on a medical concept called viral inoculum, or how much of a virus a person is exposed to. You'll hear an expression associated with this called viral load. The more of a viral load you take in, the sicker you will be with a virus. And that is really the postulation that was being looked at for this was how much virus load can a face mask prevent? And therefore, even if you do get coronavirus, you are less sick. So back to these hamsters, it was tested on hamsters, and it was tested on them with the SARS-CoV-2 virus, which is the virus that causes coronavirus. What they did was they had hamsters in a cage, and they blew air into a cage that had in it coronavirus. And they measured who got sick and who didn't and how sick they became. And what they found was that when masks were used to filter the air that went into the hamster cages, the hamsters were less likely to become infected. And if they did become infected, they had a much milder disease. Now we switch to some real people. There was a cruise ship from another place where data was collected there as well. It was called the Shackleton, which was a cruise ship. I don't know what line that belongs to, sorry, but it is called the Shackleton. As soon as the very first case of coronavirus became evident, everybody on the ship was issued a face mask. The passengers were given surgical masks, and the staff were given N95 masks. 58% of the passengers and crew ended up testing positive for coronavirus, but 81% of them, a full 81%, were asymptomatic. So they definitely had coronavirus, but they were showing no symptoms. Pretty interesting data. Again, a fishing plant in Oregon where all workers were given face masks every single day had 33% of the workers test positive for coronavirus. But listen to this, 95% of them were asymptomatic. Let's be clear. In cities, countries, areas, regions where masks are worn, the number of cases can go up, but the death rate can go down. The CDC's chief medical officer for the agency's COVID response, CDC is the Centers for Disease Control, has said that wearing a face mask means less virus is being inhaled from other people, and you're inhaling less virus, or sorry, exhaling less virus toward other people. Doesn't that make sense? Does that not make a ton of sense? And it is backed up by data like this from the cruise ship and the fishing plant. It does mean that people who don't feel sick should still wear masks because such a high percentage of them could very well be asymptomatic but have the virus. So this is why health officials are being so rigorous in saying in areas where face masks have become mandatory, you need to wear them. Wear them, wear them, wear them. If you're in public, wear them. Again, let's say that hand washing and social distancing needs to be in your toolkit. A face mask is not going to be the be all and end all and should not make you feel like you're Superman or Superwoman. It doesn't give you a pass. Okay, so that is that piece on masks. Now I want to talk with you a bit about furnaces, and I'm sorry, this might be like watching paint dry, but it is so important. It's important for our health, and I want you to stay tuned because there's actually a proviso for the HVAC units that I want you to understand quite clearly. Now, HVAC units, what is that? Heating, ventilating, and air conditioning. It's a term that's usually used in connection with commercial buildings, but every home, apartment, condo, anything has HVAC. If you've got a furnace, you've got HVAC. Let's assume you have air conditioning. If you don't have air conditioning, I guess it's just HV, but HVAC stands for all of that. So I first paid attention to this a couple of weeks ago when I was scrolling through Facebook one morning and Governor Andrew Cuomo was live. Now, he was talking about furnace filters, and I thought, what? But I think that Governor Cuomo is a pretty smart guy. And I'm not going to lie, I think that brains are pretty sexy. So when smart people talk, I like to listen and sort of go, a little bit. And he's kind of cute. So I watched, but the information was really solid. He was talking about furnace filters and the role that they play in keeping us healthy. So the data, again, that has been collected on this is not evidence-based science, but it was intentionally set up, and all the data, again, looks good. And I think it can guide us because it was assessed by scientists. Here's what they looked at. A restaurant in China where a cluster of 10 diners, all on the same side of the room, and in line with the airflow of a wall-mounted air conditioner, became sick with coronavirus. The people on the other side of the restaurant who were in a different airflow stream didn't get sick. That sounds pretty interesting, yeah? At the Oregon Health and Science University Hospital in Portland, 3 different HVAC units were swabbed, and 1 out of every 4 swabs tested positive. At the University of Nebraska Medical Center, air samples were collected from the rooms of COVID patients, actual rooms of COVID patients, and genetic material from the virus was detected, even in samples collected 6 feet away. That's very telling. That is really very telling. You may have seen, as I did, and this goes back maybe 3 months, there was a test done. It was a postulation. It was measuring the airflow of droplets. So water droplets that were carried by airflow. So this is kind of a combination of the two. And what they ended up concluding was that if you're in a grocery store and somebody sneezes or coughs 2 or 3 aisles over, you could very well be in that airflow. So you don't even have to see the person. The airflow could carry it to you. Really good reason. Okay, so when I heard Governor Cuomo talk, he was talking about furnace filters with a MERV rating, MERV. I'd never heard of that before. So he said we needed at least MERV 13 filters. Never heard of this before. So I started investigating, and it turns out the MERV scale is a real thing, and it's printed on the side of the furnace filters when you buy them at the store. I'd never gone looking, but here's the MERV rating chart right here. It goes up to 20. Now, 13 is what Governor Cuomo said we needed, and 13 is listed as superior commercial buildings. Stay tuned though, because the kind of furnace you have matters. And you can go up from there just to show you how serious this is. 14 MERV filters are used in smoking lounges, 15 hospital inpatient care, 16 general surgery, 17 carcinogenic materials, 18 pharmaceutical manufacturing, 19 radioactive materials, and 20, which is the highest, is used in clean rooms. So 13 is pretty high up there. It starts at 1 and goes up to 13. So I went, you can Google that. I Googled this MERV rating chart. You can Google that, and you can find your chart as well. So I went looking. I went looking around my town. First I read a lot of articles because even though he's Governor Cuomo and he's kind of cute, I still wanted to know for myself. And indeed, I didn't find any evidence-based science articles, and I went up to about the 3rd or 4th page on the Google search, but I found a lot of articles, and they all talked about MERV 13 as being highly functional in terms of removing allergens, viral particles, dust, and other airborne bad things. So they said that the MERV 13, now in one article, the MERV 13 was the N95 mask of the furnace filter world. I thought that sounded pretty good. So off I went in search of MERV 13 furnace filters in the town where I live. Um, I had always just bought the cheap and cheerful ones and replace them every month. Swap them out, no big deal. Look at all the pet hair, whatever. Anyway, I went to two stores in my town. The first one didn't have anything higher than a MERV 8 and didn't really know what I was talking about. And then I went to the second store. For those of you who live in Canada, Home Hardware, that's where I went. And they had a 12, they had a MERV 12 in the size of furnace filter that I needed for my furnace. We looked in their computers. There were a couple people working with me on this. We looked in their computers, and indeed, they could access MERV 13 furnace filters. It's not something that's requested a whole lot. Bet it will be now. Anyway, they've ordered a bunch of MERV 13s for me. I've got about, these only need to be changed every 3 months. So I asked for 6. That's about a year and a half supply. And I bought the 12 and brought it home with me and installed it in the furnace. Now, here's the important piece that you really need to understand before you just can't go out and buy these filters and whack them in. Your furnace needs to be able to handle this level of filter. It's a pleated filter and it does reduce airflow. Reducing airflow in furnaces can be very dangerous for your furnace. It can have components that overheat, trying to push air through. Air exchangers and things can break and crack, and you need to call the person who services your furnace or the company that made your furnace and have the model number of your furnace and ask if it can handle MERV 13 furnace filters. I did, and I found that my furnace can handle them very well. I got the regular size, the regular thickness of filters that I always get, and my furnace handles them quite well. So all good on that front, but please make sure you do this because it seems that MERV 13 is just, it's another way, it's another tool in the toolbox. It's another way that we can protect ourselves and keep ourselves safe, keep our employees safe, keep visitors safe, if it can filter out some of these viral particles. Okay, so that is the new news I have for you about face masks. This drumbeat of I wear mine to protect you, you wear yours to protect me. No, you wear yours to protect you and you wear yours to protect other people. It works both ways, and there is good solid evidence to believe that that is true. Okay? And check your furnace filters. The higher the number your furnace can take, even if you can't take a 13, see if your furnace can take a 12. Don't just stop, ask the second question. If you can't take a 13, can your furnace handle a 12? Can it handle a 10? What is the upper limit? Because the higher the number, the more viral matter that furnace filter will remove from your HVAC system. And you can check with your employer at work too. Commercial furnaces all have filters. So check with the powers that be because they may not know this information. It's all new to me, but thanks, Governor Cuomo. Always like to hear good information from smart people. All right, folks, that is our show for today. Thank you very much for joining us and for sticking with us. Again, if you have any questions, pop them in below. I always appreciate your comments and your likes and your loves and all of that stuff. I hope you will join us next Wednesday at 12 noon for another edition of The Oldish TV. Until then, be good, be well, take care of yourselves, and do remember that it takes a village to age a senior. Bye, everybody.